What do men want? What kind of treatments do they seek? What should they be putting on their skin? I'm Dr. Ozzy, your favorite board-certified dermatologist. Welcome to my office. I normally don't record here. What do you guys think of the new set? Comment below. I'd love to hear from you. Today, I want to do a deep dive into men's office treatments, their skincare, because I feel like I make a lot of content for the ladies and the girlies out there, but I'm hearing that the men feel a little left out. So I thought I would dedicate an entire episode to men. So men are from Mars and women are from Venus. So of course their skin is going to be different. Let's talk about the difference in male versus female skin. So first off, men have thicker skin. They have more things in their skin. They have more oil glands, more hair follicles. So their skin also has structure, whereas women's skin tend to be thinner and they tend to age about the same until women hit menopause. Then we see a much more rapid increase in aging in women versus men. Now also men tend to produce double the amount of sebum, which is the oil that our oil glands produce, than women. So they're less likely to get dry. And that might be why a lot of things feel heavy on their skin. They're less likely to use, creams and lotions, and they prefer a lighter formulation of products. Their skin is also more acidic, so they tend to get less reactions to skincare products. They just tend to have, tougher skin because of that increased oil and that acidic nature to their skin. In aesthetic dermatology or cosmetic dermatology, plastic surgery, we have certain features that we try to use as guides when we treat males versus females, such as certain attributes are associated with more of a masculine appearance, whereas others are more, feminine. Now, this is subjective and it can vary across cultures. So no hate here on, what is defined masculine or feminine. This is just, cultural and serves as an aesthetic guideline for dermatologists and plastic surgeons. So starting off with what we consider as masculine, males tend to have broader faces, more prominent jawlines, wider chins, and they tend to have more prominent brow ridges, and that we consider more masculine, whereas women, they tend to have softer features. So a much more narrow chin, they tend to have more rounded faces, and not particularly super strong jawlines. But in males, deeper set eyes are considered more masculine. And that might be an unpopular opinion, but again, these are just guidelines based on, evolutionary traits for men versus women. So don't come after me. And then lastly, skin texture. In women, we want this smooth porcelain skin with no wrinkles, whereas with men, we want to see a little bit of ruggedness. So I'm not trying to make a man's skin, smooth as butter, as we would for females. We want to maintain a little bit of texture and roughness to their skin. Let's talk a little bit about skincare, because we've all seen that joke where men use one product for their hair, their face, their body. It's like one shampoo that does it all. Well, again, it's because their skin doesn't need as much moisture and it's not as sensitive because their pH of their skin is much lower. So because men's skin tend to be oily, they tend to be more prone to breakouts, particularly when they're shaving, like razor bumps and so forth. So one of the most common complaints is ingrown hairs from shaving in men. And the best advice is you don't want to do a super clean shave. You want to leave a little bit of hair on the surface of the skin, because what happens with ingrown hairs is if you remove too much of the hair where it kind of gets stuck underneath the skin, as the hair regrows back, it's going to get curled in and it's going to get stuck underneath the skin. So ideally shave in the direction of the hair because it won't give you as clean of a shave. You can also use an electric razor if you find that you're prone to ingrowns. I really favor exfoliating, maybe not right before you shave because shaving is a type of exfoliant, but using medicated pads like clarified pads will help with reducing the buildup of skin on the surface of the skin. And there's a medicated cream called Soothe HC that I give a lot of my male patients who are prone to irritation and razor bumps. And you can apply that right after instead of your aftershave. So it helps calm inflammation and breakouts. Another common skin concern is dandruff or flaky scalp. A lot of people think that it's from having dryness in your scalp, but actually it's due to buildup of oil and yeast. So using a shampoo with zinc pyrithione really helps. This is like Head and Shoulders. You can also use ketoconazole shampoo or Nizoral shampoo. The benefit of that is also been shown to grow hair. So if you're struggling with hair loss, then I would suggest that. And what that does is it reduces the oil and the yeast that cause dandruff. Now, if you still struggle, then you can use a glycolic and salicylic acid spray, like the one spray. You can spray it right onto the skin of the scalp. And in worst cases, if none of that still is bringing you relief from dry, flaky scalp, then you may want to consult a dermatologist and ask for medicated prescriptions that help calm the inflammation. And then in terms of sunscreen, it's always a struggle to get men to put on sunscreen because, again, a lot of times it feels very heavy on their skin. So these are the top products that I favor in terms of sunscreen for men. One is by La Roche-Posay. I actually have a sample of it right here. It's called UV Hydra, and it is super light formulation. It has hyaluronic acid in it, and it just disappears. It's fast absorbing, and I find that my male patients really like it. Another favorite is Ulta MD's UV Clear. This has niacinamide in it, which helps with oil regulation, and the formulation is, again, super light, disappears really easily and quickly. Also, gels and water-based formulation tend to be more appropriate for male skin, and I love the SPF powders, particularly this UV Clear. It goes on completely clear. Now, powders are not great at providing, the best protection, so I like them just for reapplication, but you should really get a good, lotion-based application in and use the powder to reapply. I'm going to link a ton of the products here in my link in the caption, so check it out. So what are some of the top treatments that I perform in men in my office? Well, a lot of times men come in and they're not about getting rid of all their wrinkles. They just want cleaner, healthier skin. And so some of my favorite treatments are the V-beam laser, which is great if you have broken capillaries, if you flush and blush, if you have rosacea. This does a great job of not only treating the symptoms of rosacea, but also just removing those facial veins that can really make the skin weathered and discolored. So another treatment I really love is the Cyton BBL, which stands for Broadband Light. I love this for H-spots, sunspots. It just cleans up the weathering that we see from sun damage. And actually, studies have shown that if you get this done regularly over a number of years, we've taken skin samples from patients that show younger skin markers when they've had regular maintenance treatments with the BBL. But it's one of my go-to, especially in Southern California, where we see so much sun damage. And, like I said, men are not as great about wearing sun protection as women. Now, another treatment I really love in men is called the halo laser. So I love the halo laser. It is a non-ablative resurfacing laser, which helps with skin texture, helps with lines and wrinkles. It also helps remove precancers. And studies have shown that having a treatment like the halo can reduce your risk of developing skin cancers down the line. So not only is it making your skin better to look at, but it's also making it more healthy. So this is one of my favorites for men. A lot of my male patients really love the way their skin looks. It just looks cleaner and healthier after. And it's not one of those lasers that leaves your skin like open and raw and oozing. It's just a 3 to 5 day downtime where you're just a little red, a little swollen, but the skin heals really fast because, again, it's non-ablative, meaning it doesn't disrupt the surface of the skin. I also do a lot of injectables in my practice. Here I'm in my numbing nook. This is where patients sit and relax and numb while they're waiting for their procedure. Let's talk about some of my favorite injectables. I see a lot of men for profile balancing. Whether they're seeking a more prominent jawline, or they have a dorsal hump on their nose they want to fix, or they want more chin projection, then we resort to using various fillers to help with contouring and balancing the face. So some of my favorites for men is Botox, which is this firm, very rigid filler. I love this for the jawline area. There's also Voluma. It's a little softer than Botox. It's not as firm, but it works really well along the jawline, as well as the chin, because a lot of times we evaluate the chin with respect to the jawline because we want them to be harmonious and in balance with one another. So some people may have a really strong jawline, but they don't have as much chin projection. And so in that case, we want to work on the chin, and vice versa. I also love Radius, which is a filler that's derived from bone, and it is white and it is very firm. And I love this for the jawline area, as well as building out the cheeks. If we're doing contouring of the lower face, some men tend to have a little fullness in their neck, which can compromise their jawline. So Kybella is a non-invasive, non-surgical injection. It's like a detergent. And when we put it into the neck fat, it dissolves it. It also works well for the love handles. A lot of men, no matter how much they work out, they tend to get fuller love handles, and so this helps eliminate and melt little fat pockets that we want to try to contour. For men that tend to work out a lot and they've lost a lot of facial volume and they get this gaunt, very sunken in appearance of their cheeks, Sculptra is great. It is not a filler. It is something that stimulates your own skin to form collagen, and it adds volume. It's very subtle. We do it in sessions, and it comes as a vial. So it just helps kind of build volume over time. And then I have this little electric needle. A lot of times we see men in for growths that form on their skin, particularly oil glands, something called a sebaceous hyperplasia. It almost looks like pimples. They're almost skin colored, but they tend to come up with age, and I love removing them using this device. We also remove brown growths that are raised, that little bumps that can come up around the nose called fibrous papules. This is my go-to little electric needle. Lastly, let's talk about Botox, or brotox as we refer to it in men, because our goal again is different when we treat men with Botox as opposed to women. With men, they don't want to have the arched feminine brows in a lot of cases. We want to keep their brows kind of more even and straight across, as opposed to giving them an arch. Now, you may not know, but there are actually 5 different types of Botoxes on the market. They're made by different companies. Essentially, they all do the same thing. We inject them into the muscle that then stops them from contracting and working. Well, this can do a lot of different things. Yes, it does help smooth the skin, so it helps with fine lines and wrinkles, but we can also get it to lift the brows and open up the eyes. And a lot of men are bothered by these lines that come in between the brows. They're called the 11s because it makes people look angry. Even when they're not angry, it can cause you to appear that way. So these, what we call neuromodulators, are great at preventing that frowning motion. The other thing that happens with age is a lot of times we tend to curl the chin up towards the mouth area. And over time, it can cause a very deep crease in this area and almost, short you out of having that masculine chin. So we can also use it to relax the chin muscle, which allows the chin to not be bunched up and towards the mouth. Of all the neuromodulators on the market, some of my favorite is Jeuveau for men, as well as Botox, but really Dysport. If you're a man who hasn't seen great results with your neuromodulator, Dysport tends to be a little bit more robust, especially for that male muscle contraction that we see in the face. Their muscles tend to be just stronger. And so Dysport works great. It kicks in faster. It tends to cover more of the muscle. So this is probably one of my favorite neuromodulators for men, called Dysport. So yeah, the goal isn't to make their skin completely wrinkle-free. The goal is to soften some of the wrinkles and also help lift the brows, because as we age, our eyes tend to get heavier. Another complaint I get from men is eye bags. They come in and they just look tired. They want to look more refreshed. They don't necessarily want to do surgery. So an option is we can use a filler called Eye Glow, which is a white opaque filler that helps lift the under eyes, mask the eye bags, and just gives them a more refreshed appearance, like this example right here. We can also remove the eye bags without surgery, another popular treatment in my office, and it is using a tiny little needle that goes into the eye bags and it literally melts the fat that's in the eye bags. There's hardly not much downtime. You have a little bit of swelling, a little bit of bruising, but patients really love that because it doesn't involve any type of cutting. All right, guys, I hope that was helpful and gave you some valuable tips and tricks and information on all things men. Thanks for tuning in. Don't forget to rate, review, and subscribe, and share this with a friend because sharing is caring. Bye, guys. What do men want? What kind of treatments do they seek? I'm your fourth.
I'm Dr. Ozzy. Sorry, Dr. Ozzy.
Okay. Really thin faces that. Okay. Seek. What should they be putting on their skin? I'm your favorite doctor.
You know that I'm Dr. Ozzy, and then the rest will flow.
Your favorite dermatologist.
I'm your favorite Dr. Ozzy. You should just say.